You can expect a major change in your life after bariatric surgery. Most people expect that they're going to have terrible pain and they're going to be flat on their back for a long period of time after surgery. It's not the case. We do bariatric surgery laparoscopically at this point, which means our incisions are about the size of my pinky finger in width. 4 or 5 small poke incisions of that size are not things that hold people up for a long period of time. Most people are up and walking 2 hours after surgery, after even the most dramatic bariatric surgery done laparoscopically. In a situation where people do open surgery and need to make an incision in the abdominal wall, your recovery may not be as quick, but you still will get mobilized and will be able to get up and move around afterwards. And the biggest issue after surgery is generally not the incision and not pain from surgery. Orthopedic surgery hurts. When you break a bone or you have a bone fixed, it hurts, and your rehabilitation afterwards hurts. Not so with what we do. Surgery does hurt. Wounds of all kinds hurt, even a paper cut hurts. However, the biggest issue after bariatric surgery is generally not pain. Most people are up and doing their normal things around their house by the time they go home, or the day after they do go home. Under the circumstances, they're physically capable of doing things. However, the problem is that they're trying to change immediately what they've been accustomed to doing for many, many years overnight. And most of us learn to eat when we're about 6 months old. So if you're having bariatric surgery at age 42, that's been 41 and a half years of time that you've been taking it for granted that you can just pick up a glass of water and drink it. That becomes a very mind-blowing situation after surgery when you take your first sip and you realize you have to concentrate on what you have to do to drink a simple glass of water. You can imagine that you get mentally fatigued when you're dealing with that on a day-to-day basis. You do get accustomed to it, it does get easier, and you do figure out how you have to do what you do. But it's very difficult to explain to people what their experience after bariatric surgery is going to be like, because it's very difficult to get them to understand that it's going to be difficult to take a glass of water, or to take a handful of pills, or to get out and do what they need to do during the course of the day. We prepare our patients so that they have protein supplements and that they have their vitamins and that they have most of their bases covered prior to having surgery so that they don't have to think about those things in the immediate recovery after surgery. But it's a situation where fatigue is their biggest enemy, and our patients don't go back to work immediately because they need to learn how to drink and how to make sure that they get their supplements and their vitamins in an appropriate fashion so that they're not struggling to pay attention to what they're doing at work, where they're expected to be productive, and trying to keep themselves safe and healthy at the same time. And they're losing weight dramatically quickly, faster than they've ever done in their life over the course of the first several weeks after surgery. So it's a very life-changing affair. As they stabilize after surgery, different issues become an issue for them. Buying clothing. How quickly will you change sizes? What are you hearing from your people that you work with? What are your social experiences associated with people that you've known for years? What are their opinions and their comments which they feel to be capable of making at any time? All of those issues come into play. They don't have anything to do with the cutting, stapling, or tying that goes on from the time of the surgery, but they have everything to do with life changes after surgery. And it is an intellectual carpet ride that most people are not entirely prepared for. That's why it's important that you have a psychological consultant that you can turn to. That's why it's important that you have people around you who can support you in the process, and why it's important that you have an office or a structure of a program where people can help you find the things that you need in your period of transition. Surgery represents the first day of the rest of your life, and it's going to be a good change, and most people are thrilled that they've made that change.